Hi, Jamie. Thank you for joining me. Hi, Joanne. Alrighty. They won't let me do a poll. Hi, Henry. Hi, Janiqua. Here. Go engage your audience. Start a poll. Thank you, Ambrose. I was so excited to show you guys my jersey tonight. I'll be with it in a minute, but let me get this question here together. Why do you take that away? I don't want to shop now. Get out of my face. Let's see. Here we go. Come on. Watch Medical Coding with Bleu. Because for coding, career, chat, engage with others, to learn about Bleu herself. Okay, so this question sounds a little funny, but I need to know, okay? Why do you watch Medical Coding with Bleu? Do you watch for coding career chat? Do you watch to engage with others? Come on, where are we at? And then, or do you watch to learn about me, myself? Okay, I have to know the answers to these questions because I gotta talk to y'all about some things. We gotta have a come to Jesus, y'all. We do. I haven't said that in a while. All right, guys. So make sure you vote. And trust me, it will not hurt my feelings, okay? Whichever way you vote. I'm doing this to make a point, okay? Just gonna be clear there. Hi, Travis. Yes. Hi, Liz. Jamie, how are you doing, Blue? Well, as it turns out, I have allergies. So I was at the doctor's office today. So I was at the doctor's office. I ran to the doctor's office after work. Stayed there. I was there for about almost 2 hours, right? And then I picked up some dinner, which was dinner at this Greek restaurant. Oh my gosh, this Greek food at this restaurant is amazing. I haven't been there in a while, but I said, you know what? I came all the way over here. Let me take advantage while I'm here. So I went and I picked up some dinner, which was the gyro meat, the pita bread, the salad, which was amazing. Okay, amazing salad. Their tea, which is right here. The tea, caffeine, keeps me going. And what else did I get? Oh, cheesecake. The turtle cheesecake, because I couldn't help myself. And I said, you know what? I've been working really hard, so it's time to treat myself. So I did that, and then I raced home, and then 15 minutes after I got home, I had an appointment with a client. So I was with my client for 30 minutes, and then I ate my dinner really quick and put on my jersey. And then I wanted to come on here with all of you. So, but I wanted to make sure that I did all of this in short order because we have some chit-chatting to do. Oh, Travis, me too. Hachoo. Thank you, Jamie. Let's see. Thank you, SF. I really love this jersey. Hi, Crystal. Hi, Alexandria. Gyro, Hero. Not really sure. No, I don't know how it's pronounced. Hi, JR. I feel your pain about the allergies. I didn't realize how bad it was until I went. And so the doctor was like, yeah, these are allergies. And I'm like, oh, Well, now that makes sense. Everything starts to make sense. So, antihistamine is coming my way. But the other two answers also. Um, Zuppo Toscano. That sounds so delicious. If I had the time, boy, I would be cooking. I really would. What is the number on the back of your jersey? So it's actually, I get it on the front and I got it on the back. The back has my last name, Garcia, and then it's got '08. So 08, 2008 was the year that I became a medical coder. Okay, so medical coder established in 2008. And so I got this jersey and it says medical coder on the front with '08, and on the back it's got Garcia and it's got '08 in the big letters. No, I'm not going to turn around because you never turn your back on your audience, okay? That's the theater trained in me. So, all right, let's see. If you're just tuning in, make sure you vote in this poll I got going on over here. You do not have to worry about hurting my feelings, whatever way you vote. I'm doing this to prove a point because I know certain people are watching me and I want to prove a point. So, Travis, Letty, hi Letty, doing great. 8 is like infinity, infinity and beyond. That and Crystal, thank you so much. Allergies stink. I got my shot and my arm swells up every time I get the mold shots. Oh, we like looking at your hair. Oh, thank you. All right, so a couple things we're going to talk about tonight. One of them is going to be about the AAPC fill in the blank thing with their tests that they're going to do. And so I'm going to talk about that. The other thing I'm going to talk about is myself. So I'm going to go ahead and stop this poll because, again, this is just to prove a point. Let's see. What are the results from the poll? In the poll, what do we got? What are the results? Were you here, JR? Where's the thing? Where did my poll go? My results. Well, I think most of them were, I didn't get to see my results. I think most of them were for, that you're here to learn about the medical coding career. Okay, so here we go. So 19 people voted in this. 19 people voted in this poll. Why do you watch Medical Coding with Bleu? 94 say for coding career chat. 94%. Engagement with others is 5%. But guess what? To learn about Bleu herself is 0%. This is why I say it's not going to hurt my feelings because I want to prove a point. Yesterday, I got an email, and this really just, it irritated me so bad. Normally, emails don't irritate me like this, but there's two things I don't like. Assumptions and ignorance. Those are two things I don't like. I have very little patience when it comes to that. This channel is called Medical Coding with Bleu. I share personal things very rarely on this channel. Y'all know about my mom. Y'all know, or the ones that have been watching for a while know about my mom. Y'all know about my Uncle Kyle, okay? Those are two things that y'all know. Y'all know about my fast car. Those are the three things y'all know about me. That's all you need to know, really. Because, again, at the end of the day, y'all come here to Medical Coding with Bleu to learn about the coding career field and some tricks and some tips and things like that. That's why y'all come here. That's why I have the channel. If I had a channel about like life and advice and all this other good stuff, then yes, I could understand. But here's the kicker. Yesterday, I got an email from a lady. She's going on and on about her question. And she's asking about the fill in the blank thing for AAPC. Again, I'm not affiliated with AAPC. And I will never be affiliated with AAPC because I have a HEMA. But I will still entertain the question. But the thing that got me at the end was, oh, I saw your ring. Congratulations on your engagement. This is what she's talking about. This ring. Okay. This ring is a fashion ring. It is a fashion ring that I bought myself. Okay. Because I like it. Why? Because it has a blue stone in the middle. There's a couple colors that I love. I love blue. I love purple. I love black. I love red. These are all the colors that I love. But this one happened to stand out and catch my attention. So I got this ring. I've worn it. No big deal. Great. Nobody's ever said anything until that comment. Congratulations on your engagement. First of all, you don't know me. That's first of all. Second of all, I write back, and of course, I'm quick-witted, and I say, oh, I'm engaged now? I said, well, gee, I hope it's a nice fella. I said, because I didn't know about it. And I said, don't assume. Y'all know me. Y'all know that I'm direct. I will say things directly. Because when you come back at somebody who made an ignorant comment, it's not because you had a bad day. It's because you made an ignorant comment, okay? And even though you say, Blue, why are you so upset? You know, she just assumed that you were engaged. She could have asked me. She could have said, that's a beautiful ring I noticed you were wearing. Are you engaged? If you are, that's so exciting. Congratulations. That would have been a lot better than just assuming, like, you know me and you know everything about me. Okay. So she comes back and says, I didn't assume. I saw the ring. And so that's why she said that. She goes, I didn't assume it was a man. Now you want to be an a-hole. Okay. All right. Just relax, right? So I'm laughing now because there's something that happens to me when I get like really upset like that. I start laughing because at the simple thing, you know what? You're a simpleton because you made this assumption and now you can't even apologize for making an assumption. You know, a couple weeks ago, I went for my annual checkup. The guy that checked me in, he says, oh, hey, how you doing? It's good to see you again. I've never seen this guy before in my life, but maybe I look like somebody he knows. Okay, cool. And so I said, oh, thank you. It's good to see you too as well. And he said, well, how was your holidays? I said, oh, it was great, you know. He goes, so what did your kids get you? I said, I don't have children. And I just said it just like that. He goes, I said, no, you're fine, don't worry. And he's like, oh, okay, well, come on back to the room then. He's like, oh my gosh, because he assumed. But he immediately apologized that he was sorry for making an assumption. Don't be sorry. I mean, you know, you would think that, hey, you know, somebody's Hispanic, I would have children. I don't have children, okay? But I don't talk about that here. Why? Because, again, no one comes here to ask about Blue. You like my attitude, some of you hate my attitude because you say, you're so mean. No, a lot of y'all need to be toughened up because, again, at the end of the day, it's the real world. The real world is a tough and scary and mean place, and it'll knock you down and it'll keep kicking you unless you have that drive and that will, which everybody has, to get right back up and keep going. And that's what I want for y'all because I want y'all to be successful. So, again, this lady didn't even apologize. She said, well, I saw the ring. Rah, rah, rah. Okay, fine. And I put, you did assume. And I put a row of laughing faces because I was laughing at her at that point. Okay. And then that whole conversation is closed. I get to the end of the night. I look at my phone about midnight because I'm winding down for the day. Get to the phone. And I look and I see this message from another lady, right? I get messages all the time. I see this message from this lady. She goes, oh, Blue, I work in an office and we all love your channel. And, you know, we just, you know, love all the things that you talk about and everything. And, you know, one of my coworkers is so sad to hear that you are engaged. That lady who ran her mouth to 7 other people in her office. And now they all think I'm engaged. And I'm the last one to know. So I told her the same thing that I told that other lady. I said, you're from that lady's office that was assuming. And I said, I told her not to assume. And she told me, oh, I pray that you have a better day. No, I came back at you because you were being rude and you can't apologize. That's why I came back at you. Has nothing to do with, oh, you're having a bad day. I'm having a fantastic day. You know why? Because when I go to work, I have a group of doctors who love to come and talk to me. And in that day, I had 2 show up at my door. I had 1 who called me on the phone. And so I have all of these great interactions with my providers. That's the best part of my day, when I get to do education and I get to educate people about coding and what it means. And then later on, when I come home that night, I got 2 study halls. I got the study hall that I have for Patreon, and I have the other study group that I run with 2 fantastically dedicated girls who are determined to learn medical billing and coding. And they've been working with me for the past few weeks. That's a fantastic day to me. But here this lady goes, oh, have a better day. No, my day is great when I don't have to deal with ignorance. That's when my day is great. And having to respond to your comment, and you can't even say, you know what? My gosh, I'm so sorry. It would have been that simple. So here I will say this to all of you. I am not married. I am not engaged. If you have a personal question about me, I may or may not answer that question. It's up to me. Because at the end of the day, this is YouTube for Medical Coding with Bleu. When I first started the channel in 2018, I had a stalker situation. Some fool from overseas, thought he was going to be Johnny on the spot. He chased me all over the internet, looked me up on my own personal Facebook, which I had to change my own personal Facebook because of him, because I don't want to expose all the people that I know to some fool, some crazy guy that I don't even know who you are. Like, really, bro? Calling me on Instagram. Really? He's like, well, if you're not interested in me, you need to tell me. Bro, I don't even freaking know you. I owe you no explanation, no excuse, no nothing. So with that, you can sit your little hiney down, and I will go on about my way. I had another guy say, oh, what is your marital status? What is your age? And what is your location? I asked him, I said, are you with the census? He goes, what is census? He said, no, I really want to know about you. That's not why I'm here. That's not why I'm here. I'm here to talk about medical coding. That's why I'm here. I'm not here to deal with this freshness from all these people who think that they're going to try to be cute and send some stupid message to me. So that, I'm making it very clear. If you want to know something personal, because maybe you watch me all the time and you say, you know what, I wonder if she likes this team, or if she's, into like this sort of water sport or something like that, I'm going to ask her. That I may answer, because it's not too personal. Okay, cool. Oh, can you tell us a story about when you first started coding? Okay, great. I can share that with you. I'll be happy to share that with you all day long, whenever you want. All you have to do is ask. But you have to give me the choice. You have to let me answer you. And don't sit there and assume, because assuming pisses me off. I don't like assumptions, especially when it's about me. And look, 8 people all think the same thing. And this other lady, oh, you're a B word, right, and I'm going to tell everybody. Well, if everybody believes you and as ignorant as you are, I don't want those people around me anyway. Thank you. So again, with that said, if you have a question about me, you ask me. You do not assume, okay? Do not assume just because you see a ring on this finger that, you're engaged. Oh, you're engaged. It's a fashion ring. It's a fashion ring. Why? I love rings. I love jewelry. You've seen me. I have earrings. I have a necklace that I wear normally, but I don't wear it all the time now because I don't feel like it. So again, ask me, and I will answer you, or I won't, and I'll let you know. But at least I'll thank you for coming to me and not just assuming. Okay? So with that all said, let me see what I missed, and if I need to block some people because I'm sure I made somebody mad. Let's see. Alexandria, you see? Alexandria knows. There you go. Alexandria said it best. I thought you didn't like to share personal info. I don't. But I need to be clear, because obviously people be saying things and just making up stuff. So let me be clear on what it is. I'm not married. I'm not engaged. Period. Okay. Travis says you are a teacher, but appreciated. Let's see. Travis says how you started. JR says, no, I wasn't here last night. I noticed. Jamie said new information about medical coding. Alexandria, I love picking out my own jewelry. There you go. JR, did you get mad after the email and punch a wall? I don't punch walls. Do you see these nails? I would break them if I did. So no, I didn't do that. I didn't do that. Liz says, you better love Bleu. Keep your personal life personal. There you go. Humble says, Miss Blue, I scheduled to take the CCS exam April 1st. Even though I've been studying for 5 hours a day, I still feel nervous. You shouldn't be. Jessica says, good evening, Blue. Absolutely love your jersey. You tell it straightforward. Ignore anyone trying to find out. um, yeah, I was nice. Thank you. Ambrose says it was probably the same lady, to be honest. Well, probably so. Needy. I don't know. The only way to handle that bit. Yep. Preach. Liz says, I wish you were my coworker, Blue. Ah. Just tuning in. Oh, sorry, Nadia, that you had to see all that. JR, you always starting something. You're in trouble, Nadia. Let's see. JR. Okay, so Liz says, your personal life is not our business unless you choose to share it. There you go. Oh my God, you had me there, JR. Don't share too much. Who cares if you're getting a man? We like you no matter what. Thank you, Travis. Jamie says, your personal life is not our business unless you choose to share it with us. Thank you. And your stylish glove. This is more for utility than style, trust me. My hand hurts too, and that doesn't help because, like I said, I injured myself. And I have this. That's it's gonna be here for a little bit. So let's see. SF. Exactly. Your personal life is none of our business. Period. Yeah. Ladies, don't forget to thumbs up. Thank you so much. Hi, Kai. All right. So let's talk. So with all of that craziness out of the way, do y'all love my jersey? I got this off of Amazon. So I have been wanting to get merchandise for the channel, right? But I can't seem to find something that I like, and I've been trying different things. So I was like, you know what, I would really love a jersey. And so I saw that they have customizable ones on Amazon, so I was like, yay. So of course I had to get this. So I put medical coder on the front as the team, and then 2008 was the year that I first became a medical coder. That's when I got my CCA certification. So that's why I did that. No one can code love. I don't think there is a code for love. Thank you, Liz. So I really like the jersey, and I was like, you know what? I'm gonna wear this for the show, you know, so that way they can see it. So the jersey would look much better with an engagement ring. Ha ha ha, funny. So anyway, let's get into the update on the AAPC exam. So I wasn't able to find a date when they're going to implement this. They just said it was 2024 from the articles that I had read, that they're going to go to a hybrid version of the test where it's going to be like multiple choice and fill in the blank. And of course, the fill in the blank part is making people panic. I don't know why y'all are panicking. You know why? Because if you've been studying and practicing like you're supposed to, you're not going to have a problem answering the fill in the blank questions, because guess what? When you get in the real world, is it going to be multiple choice? No. It is going to be fill in the blank the whole way. And yes, while some providers may select their own codes, they're not always going to be correct. And sometimes it's going to be the electronic health record that's selecting the codes, and they are for sure not going to be correct. So you are going to have to be the one to figure that stuff out. So you may as well on the test, right? So stop panicking if you're panicking because, oh, it's going to be fill in the blank. Again, it's a hybrid part of it, okay? So there's still going to be multiple choice on there, but I think that maybe they're trying to do this to kind of up the status of that exam, you know what I mean? Because right now, even though everybody says, oh, the AAPC CPC exam is the easiest exam to take, that is a freaking bold-faced lie. And do you know how I know it's a bold-faced lie? Because I'm the one who gets those emails from people who say, Blue, I failed the test 5 times already and I need help to pass it. The CPC. So this is not an easy test like they think it is, okay? Now, of course, there's process of elimination that you can use when you're getting through those multiple choice questions, but doing that's not going to carry you through the whole exam, Okay. And again, AAPC is just upping the ante and saying, okay, well, they should be able to fill in some of these blanks here. And I'm pretty sure, I don't know, but I'm pretty sure they're going to tell you how many blanks to fill in, so you'll know how many codes they're looking for. You know what I'm saying? I don't know. I'm just speculating at this point. So that being said, you shouldn't be scared at all to do fill in the blanks. That's why I tell y'all, cover up those things in the book whenever you're working with your books. You're practicing with your ICD-10-CM. Maybe you have the Optum version, like I've been recommending. It's not an ad for Optum, but if you've been practicing from that at the beginning of every single chapter, they have those little scenarios that you can cover up the answers, and then you can just look up the codes, and so that way you can write those codes out, because that's going to give you more practice. What they're trying to do, it sounds like, is make stronger coders, which they should have been doing from Jump Street, but hey, it's business, guys. It's business. So if you're taking the exam this year and you happen to have that fill in the blank, don't panic, especially if you've been studying like you're supposed to. If you're doing 20 hours per week studying consistently throughout your program, if you're reading the coding guidelines in their entirety once per week, that's going to be the basis of all 4 major medical coding certification exams: the CCS, the gold standard, CCA, CCSP, and the CPC. These are all what the employers are looking for. Okay. And again, if you're following the formula that I have set out, 20 hours per week, 3.5 hours per day, for 5 days, that's 17.5 hours, 2.5 hours on the weekend, Saturday or Sunday, and then you got the rest of the time for your family. And then if you're reading the coding guidelines, guess what? That's making you a faster reader, and you're going to be able to understand. It's not going to make sense while you're reading it. Excuse me, certainly not. But when you get into those scenarios and they start asking you about the sequencing, they start asking you about mother-baby, they start asking you about injuries, who's going to know that? You. Why? Because you've been reading the coding guidelines. You know exactly where to go to reference. It's an open book test. So with that said, that's why I tell you guys to practice, practice, practice. But there's too many of you looking for those shortcuts. Where do I tab my books? Where do I write? Where do I highlight? Don't write, don't tab, don't highlight, and do not comment. Oh, well, maybe that worked for you, but it doesn't work for me. Then you make your own channel then, and you tell the people all your advice. But I'm telling people who want to be strong medical coders, because that's what the industry needs, not people who need their freaking handheld and all of these things written all over their book, this covering up all of the words and everything else when the book already has the answers. Why are you writing in it? What education do you have that supersedes all of these other doctors, lawyers, and scholars and everybody else that has a hand in writing that book? What do you know that they don't know, that they don't already have in that book? You have to learn how to use the book. That's it. That's it. And you would save yourself so much time from all the tabbing, writing, highlighting. And I will say that all the time. I don't care what you say. If you had to do all that, that's on you. Well, it saved me time. I bet you it didn't. I bet you it didn't. You're just saying it. But I'm telling you, if you did work with the book without the tabs, gave yourself a chance to learn the book, you'll become more intuitive with the book. And that right there, my friends, is the whole goal, is to be so intuitive with the book that as soon as you open the book, you'll be right where you need to be. And I can't tell you how many freaky instances I've had where I'm with the provider and I will literally open right to where we need to be. And they're like, how did you do that? I know the book. And when you know the book forward and backward, oh, trust me, it gets real easy to do that. So, all right. Let's see what we got here. Whoa, I missed a lot. Y'all okay? All right. See, Travis. Okay, cool. Medical Coder 23 here. That's awesome. Black and gold, love the colors. That's my channel colors. Liz says, absolutely, Nadia. No process of elimination, Blue, LOL. Just kidding. Travis says the CRC exam easier than the CP. CRC is only diagnosis coding. I mean, again, and the CPC covers diagnosis coding. I still don't understand the CRC. I still don't understand, like, why. JR says a lot of stuff is still from 2023. Some of the certifications on the certification exam will include 2 essays. Jamie says no real world coding is totally different, and you will fill in the blanks all day, every day. Liz says none of those tests are easy. There you go. And JR says from what I saw, it looks like the fill in the blank is going to be the provider's report. Oh, okay. Travis says you can pass the test by backtracking the exam. Process of elimination. Okay. Nadia says, I'm okay with tests, but time tests get me so nervous. I'm taking my certification test in the spring. Jennifer says, I wonder if it's going to be similar to questions like in the CPC workbook. I'm pretty sure, because there's some questions in the CPC workbook that are not multiple choice. I love those. That's why I love that CPC workbook. Liz says, but you don't have that option in the real world either. Would be nice if you had 3 blank spots so you know how many codes to use, LOL. JR says these exams are going to be held on weekdays, not on weekends. Crystal says, you got this, Nadia. Jessica says, I just got the Optum PCS and CM code books, and I wish my coding program made us buy these for the classes. I love these books. Yay. Nadia, I love those little faces. Let's see. Sunny says, I just started my medical terminology class. Are the coding guidelines attached to the CPT book? Well, I mean, the CPT book has like the surgical guidelines in it. It's got the E&M guidelines in it, if that's what you mean. Jessica says online. Oh, okay. JR says, I would spend 20 hours with the family and the rest on the coding. Hi, Mary. Mary is a first timer. Welcome, Mary. Liz says, Blue, what do you think about the micro credentials? E&M is so confusing. So with the micro credentials that AHIMA is doing, let me think on how to respond to that one. Nadia says, question, why am I learning how to use SIM claim this week in class? Only billers fill out the claim forms, am I right? So Nadia, it is important that coders still learn the billing part. We don't do billing. I don't do billing, but when I was in medical coding school, I learned to do the billing. And you have to learn the billing, because if you don't, that's knowing only part of it. Because think about this. When you're coding, and for certain insurances, they only allow up to a certain number of a procedure, right? The quantity, they cap that quantity, okay? Like for allergy testing, some insurances will be like, okay, you can only do 80 of the little scratch test. Other insurances is 120 scratches. So it really all depends on the insurance company. But you would know as a coder, okay, this insurance company is only going to allow for 80, so we're going to put 80 as far as the billable amount. You'll still have the one, if they did 120 documented there, but the billed amount is going to be 80, because you don't want to have like a riffraff going where, oh, they're trying to charge 120 so we can deny the claim. So then they have to resubmit it again to be at 80, what they cap off at, and then, oh yeah, we'll pay the claim. And then knowing about the modifiers, modifier 25, when you have a minor procedure performed in the same day as the E&M, that's a billing thing, right? Even though it's a coding thing, we still have to understand what that means. Modifier 24, when that's the E&M that's happening in the global period. If we don't understand the billing side of that, I mean, again, we mess the doctor up on, their their money, and so that's what we don't want to do. So we have to know about billing, even though we don't submit bills. We still have to understand billing. And when it comes to like government health insurance, like Medicare, Medicaid, and things like that, TRICARE, those are very important for us to understand those billing billing practices with those as well. The different claim forms with Medicare, using the G codes from the HCPCS book for the colonoscopies instead of the commercial codes that are in the CPT book. Again, that's a billing thing, but we as coders have to know this. So it very much goes hand in hand when we're talking about what we need to know. You never want to cut off, oh well, I'm not going to do the billing, so I don't need to learn that. That's not understanding what we do and as part of it. And if you look at all of the exams, the four main ones, the CCS, CCA, CCSP, and CPC, all of them cover reimbursement. So it is very critical to learn about the different things and about billing, And sometimes you never know. Your first job may be biller / coder. To me, you really kind of want to avoid that because that's a lot for somebody new. But it does happen, okay? Sometimes I've seen where the spouses, doctors' spouses actually go through, because even I tell my boys too at work. I said, when y'all get out and y'all go in the big bad world, y'all leave here, and I said, and your spouse, your old lady, your old man, if they're the ones that are doing the billing and stuff like that, make sure you make them go to a coding class so they can learn everything, because you see too many mistakes happen. I don't have to talk about that one couple. He was either an ophthalmologist or an optometrist. I can never remember which one, but I think he was an ophthalmologist. Ended up getting a fine. His old lady who was doing the billing ended up getting 3 years in the federal pen. 3 years. Because she did the billing. And she was doing it incorrectly. Oh, but they were paying. But even though a claim gets paid, it doesn't necessarily mean the claim is correct. That's why you have to do retrospective audits to make sure that everything is right. And then when you catch an error, you have to self-report. This has to be done every single year. But a lot of people don't take this stuff seriously, and then all of a sudden they're having to pay all of these millions and millions of dollars back. And there's people that are actively watching that Medicare trust fund. That Medicare trust fund has to be good into perpetuity. Okay, it has to be able to survive all of these generations, and it has to have the money. And in order to do that, you got to watch that money. So that's why you have to know about billing. Again, I've never done the billing, but I understand it. I understand at least, the do's and don'ts of it all. I don't know the nitty gritty because, again, I'm not a biller. But then when you see billers and they say, well, I know enough about coding, I know just a little bit about coding. Oh, no. You should know more about coding, because that's what's going to keep you from having so many denials. Because there's been so many horror stories of these billers who get these claims back and they're like, I don't know why it's denied, so we're just going to go ahead and write it off. But that's ignorance, because if you had taken a coding class and if you noticed, hey, this is missing a modifier, or hey, this is not supported, or hey, there needs to be another code here, that can save the provider money. But again, it's not required. It's not an industry requirement for billers to even be certified. So that's the thing. Again, even though something is okay to do, it doesn't always make it right. And that's why we have to be educated. That's why we have to educate ourselves, because you don't know what you don't know, unfortunately. And until you start educating yourself, well, all right, what do we got here? I'm not ignoring your question, Liz. I'm still trying to formulate my answer. E&M is so confusing. E&M is not confusing. E&M is really not confusing. I am going through my little pilot E&M class program right now with my Patreons. I have a very small group, and we are going through and learning E&M together. So I am seeing where people are getting tripped up, and it is a wonderfully educational insight into why and what is making new coders tick, as far as like, why is it so scary to them. But then to hear the feedback of, oh, now I get it, now I got it, I got it, Blue, that makes me feel really good. We are 2 meetings in. I'm making it a 4-month thing, a 4-month course, and that's just, I'm just going through it just right now to see how I like it. And if it's really good, I'm gonna see, and then I'll make it more like available to more people. So, but I have said that when it comes to learning E&M, you have to be actively engaged with it, and that's just one of the things that they're doing. And so I think that that's wonderful, and I love that. I look forward to those classes, you know, which that was what happened the other night. So I really like those. I like teaching. I enjoy it so much, because it's like you get into this rabbit hole of, there's so many things that I want to pass on to people and help them to learn. And it's such a good thing when I see people finally have that, like, oh, I get it, you know. I have the CPT 2024, HCPX ICD-10, CM all 2024. Should I just spend time reviewing the content attached to these books? So, you know, Sunny, you know, I have that independent study. If you look through any of my other videos, it's not going to be in this description box, but in the other description boxes, it's going to have an independent study video. And it's going to have like a breakdown of all things that you're trying to learn. I don't know if you're trying to learn on your own or what you're trying to do. But if you are, you know, that will kind of help give you some kind of guidance and direction. And you don't have to buy all these books for like medical terminology and anatomy and patho. You could go to the public library, or you can look online, or you can watch videos from Crash Course about anatomy, which is like the #1 channel that I recommend. JJ Medicine is also really good. But JJ Medicine is for when you get really deep in it, because there's a lot of stuff that they show you on that website, on that channel, that's really good. To avoid overcharging, got it, thank you. Let's see. What you talking about, Nadia? What did I miss? Okay, got it. I got it. Okay, I got what you're saying. I got what you're saying, Nadia, sorry. JR says, and that's nothing to sneeze at. Sunny, JR, with all those books I need to start out with. Nadia says, my goodness, yes, we don't want to be responsible for office audits. Yes. JR, you're Liz says, they do at my old office. She said she takes too much time to research why it was denied. Crazy to me. Well, again, if she was educated, it wouldn't take so long. You'd be able to spot it right away. You know, I'm just saying. Sandra says, I took an online medical coding and billing course, over $5,000. Could not keep up due to family illnesses, fell too far behind. With your recommendations of books and study schedule, could I pass? I don't know. I don't know you, Miss Sandra. I don't know how dedicated you are. And I get that question a lot of, can I do this? You know, I've got all the things for all the books. Well, you know, getting all the books and having them there, but not actually opening the books, can prevent you from learning. And sometimes people will get these books and they will immediately get overwhelmed with it, and then not touch them. So again, if you stick to a schedule, if you stick to the 20 hours per week, and you're reading the guidelines, you're working through the workbooks, you're working through the problems that are in the book. Because again, if you have the Optum books, at the beginning of every chapter, they have those scenarios that you can cover up and work through. And then, of course, there's justcoding.com, where they have the free membership, where they have the 5-question coding quizzes that cover ICD-10 CM, CPT, and ICD-10 PCS. And they're 5-question coding quizzes, but you can cover up those answers and look up the codes by yourself. You know, if you're doing that and you're working through a really good workbook like the ICD-10 CM and ICD-10 PCS Coding Handbook with the Answers by Nellie Leon Chisholm, and the CPC Study Guide, regardless of what exam you're taking, because even if you're taking an AHEMA exam, you can still study with the CPC study guide because we all use the same CPT code set. And if you use that book, it's a fantastically written book. There's a couple of things in there I don't agree with, but it's okay. For the most part, AAPC got that right. I love that book. I will recommend it every time. I have recommended it so much that it used to be $10 to be able to find that book, and now you cannot find it for $10. It's like 100 and something now. Even the old books, because they all saw how they sold. I'm just saying. All right. So I don't know if that helps, Miss Sandra, but hopefully. I don't know. Liz says, I miss being part of Patreon, especially study hall. Well, it'll still be there whenever you're ready to come back. JR says, I want no part of billing. I don't even like the bills. Liz says, I don't mind billing. It's just the patient contact I don't care for. I bet. And Nicole says, or Sunny says, I'm already enrolled in a program. Hank is amazing. Liz says, Hank is amazing. I love Hank. Humble says, my self-study books, Nellie Leon Chisholm, Optum workbooks, CCS, exam prep, and bucks. Luna says, I love the Nellie book. Liz says, I was telling the folks in my Facebook groups about just coding. All right. Luna says, I am ordering my CPC study book this week. All right. Yes. So, but I mean, there's resources out there, guys, you know, and when it comes to the books that I recommend, you know, the Nellie book and the CPC study guide, those are the two big ones. You know, a lot of times people will get the CCS exam prep book from AHEMA. Now, the reason that I don't recommend, I actually have the book, okay, so I've seen it, I know it, I've been through it, and I don't really care for the setup, and people have told me, they write to me, they for some reason they don't write to AHEMA. Write to AHEMA. AHEMA is the one who makes the book. I don't. But they said, well, none of those questions were on the test. They're not supposed to be on the test. If that was the case, then there would be no way to gauge people's knowledge about coding and what they know, what they don't know. You know what I'm saying? Because people just memorized answers. And in an industry where it affects so many people, you can't do that, guys. You can't do that. You can't be cutting corners trying to learn. And, oh, yeah, you'll figure it out on the job, or they'll train you on the job. You can't always rely on the people to train you on your job. You got to be able to figure that stuff out. You know, a few years ago when I was taken out of ortho and I was sent to the pulmonary clinic, I was sent to help the pulmonary clinic because the pulmonary clinic needed a revival, okay? No pun intended. So I had coded pulmonary patients before, okay, because I had come over from professional fee coding. So I had seen a lot of the patients that were in the ICU and things like that. And so very serious respiratory illnesses and things. And so, but I'd never coded for the clinic. And so the clinic, when they're doing these procedures, a lot of these procedures include other things in the procedure codes. And so it was a matter of digging. Now, I had never been in the pulmonary clinic before, and I didn't ask my boss for help. I didn't run to her for help. What I did was, because again, she put me in there for a reason. I'm a digger. I dig. I ask questions. I dig. I interview. I get with the provider. That's a big thing for me. Okay. And I met resistance from the provider, and she was very headstrong. Y'all think I'm headstrong? Poof. No. Not compared to that lady. But I managed to break down a little bit of that exterior, that tough exterior. So, you know, because she saw what I did for their clinic, which was I turned it around. They weren't producing anything because everything was just like, okay, what's going on here? Nothing was being captured appropriately because these codes were all over the place and out of control. So when I stopped and looked at everything, we went back to square one and we fixed everything. And then all of a sudden everything was going right again. And once everything was going right, everything was going up the way it was supposed to be, and documentation was really great. I was working with them constantly, and then I got pulled out again, and it was given to somebody else to maintain while I went back to ortho. I went back to ortho, and I've been with ortho and podiatry ever since then. I've never not had podiatry, never. But I I have been without ortho because I was rescuing that clinic and another clinic as well, but more so with pulmonary, rescuing them. And but I love ortho. At the end of the day, I love ortho. But it goes to show you that you don't have to wait on other people to guide you and tell you what to do. You have to be the one to dig in there and get with whatever websites to kind of help you to learn. You know, the American Academy of Family Practice Physicians is a really great resource, okay, for just some general knowledge as well. And then, of course, going to the American Lung Association, that was really good too. And so that was what I used to kind of help me to understand, like, how do I navigate here, you know? And you have to learn to do that too. And a lot of times people will feel that overwhelmed, like, I don't know if I could do all this. Yes, you can. It's possible. You just have to give yourself the chance to do it, you know? And it's all about asking questions. And the great thing about Google is that you can Google anything. And you can find out, you know, things that you never knew. And again, you go down a rabbit hole really quick. Let's see. All right. Hank is one of a kind. I love Hank. Luna says, I am also ordering my 2024 coding books for my exam in March. Your exam for which one in March are you going to take? Luna. JR says, I got one for $14. I won't get it for 5 to 14 days, but it's an early book from 2018. Hey, it's still good anyway. It is still good. Ambrose, I needed CPR, lol. JR says, I ordered my 2024 books too. Can't wait to put tabs on them. You're begging for it, sir. You are just begging for it. Liz says, sometimes people on the jobs training doesn't know the right way either. Correct. Luna says, bad, JR. And I agree with Luna. Let's see. JR says, I couldn't resist the older one for $14. Nothing wrong with that. Nope. I live in my books. Luna says, I am working on the reproductive system right now. Liz says, Blue, you said you did oncology for a while. I know ortho is your baby, but what are your thoughts on the oncology specialty? I mean, it's good. It's a real, I think every medical coder should do a rotation in oncology. Absolutely. Because that is the best and fastest way to learn about pathophysiology. Because when it comes to oncology, everything is connected, and you will see that because it can start off, neoplasms can start off in one area and can travel to another area. And the cells from the original area will be in the site that got that it metastasized to. So even though that site could have its own neoplasm, it could also show secondary neoplasm from the originating site, all because of DNA and all those markers and everything that's in there. And it's incredible. It's an incredible thing how the body is just connected, because if like a patient takes a certain medication and then they like a chemo drug, right? Then they go and they start developing other things like anemia, you know. That's something that can happen, you know, when they're on therapy. And so that's something that you have to look out for. But is it anemia from the therapy, or is it anemia that they've had? And so that's where it gets really interesting, and it really starts to kind of like, wow, you see the amazing vastness that the body can do, because it's not just the body that's affected, it's the mind as well, because other things happen with the mind. And not to dive too deep into it, but again, that's the best way to learn pathophysiology and how the body is totally connected. I think every medical coder should go to that. And for those that are asking about like registry, right? They have those. That's actually a powerful credential to get, because of the simple fact that there are certain facilities based on like their needs that they actually have to have somebody who has a tumor register, an official tumor registrar. And so they have to have that. And so that's bargaining power when you have that credential with you. And knowing those things, again, is just, it can lead to so many things. Like, it's an incredible journey to go down, I think. Let's see. We need to put JR on a timeout. I agree. Ambrose says, do you code inpatient, outpatient, or both? Presently I code for outpatient in the clinic. I have coded for professional fee before, basically inpatient in a hospital. I've done that. I have never coded on the inpatient side, like the facility side where you're reporting PCS. I have not done that. However, I do have my CCS certification, Certified Coding Specialist. It says I have mastered inpatient coding and outpatient coding. I do know my way around PCS, and I am able to explain it. So I do those things on Patreon for my Patreons. And that was how I passed my exam too, is because of all the practice that I've had. But practical application, I have not done it, you know, so that's just me in my journey, you know. JR, the CCA exam in August. Okay, good. All right. Yes, you do got this. And Luna says, I told you, JR. Bad to tab the books. We need to put JR in a timeout. He likes stirring up trouble. Humble says, Luna, if you're taking your exam in March, you will have to use the 2023. 2024 will be allowed in May. She's taking hers in August, so she's good there. Assuming that you're taking the CCS. JR the jokester. Yes, he is. Luna says, I'm ordering my books in March. JR says, Blue, can you do live shows 4 times a week? Oh, if only I could, JR. If only I could. No, this was just so that I could show off my cool jersey, because I just got it the other day. And I couldn't wait a whole month to wear it, so I figured I'd go ahead and do it today. And not only that, I wanted to address the whole asking personal questions thing. You know, again, I don't want to go through that again, you know. And again, don't assume things about people, you know, because that's embarrassing. It's embarrassing to assume things about people. It's like the people that think that maybe a woman is pregnant and they ask her how far along are you, and she's like, I'm not pregnant. You know how embarrassing that is, you know. What is the saying about assuming? I'm just saying. So don't assume things, guys. Just ask. If you're gonna ask, or if you're gonna assume something, at least just ask. You know, and if you're wrong, say you're wrong. Hey, I'm sorry, my bad, you know, because again, that's not why y'all come to my channel. And I totally accept that, because I'm okay with that. We don't know each other. Y'all know me as far as like my crazy antics, talking about coding and things like that. That's what y'all know about me. And how I am here is very consistent with how I am in real life. This is how I am. I get very passionate about things that I love, which is this. And, you know, there's really no change in my personality. I'm very blunt. That's just, that's my natural way of being, is blunt, you know, because to me, there's just no sense in wasting time. Why waste time when we're all adults, you know? And I don't feel the need to hold people's hand, you know, but there's a lot of that neediness of, hey, I need my hand held, or, you know, oh, you're just so mean because you disagree with me. No, we can agree to disagree. And I'm sure there's a lot of things that I say that a lot of people disagree with, but they still continue to watch because they understand that. And it's okay. We don't have to be enemies just because we don't belong to the same association. We don't have to be enemies because we don't have the same credentials. You know, I certainly don't look at people who have the CPC as anything less, because I have met some fantastic CPCs who I have learned from a thing or two, you know, and I'm willing to admit that and say that because it's the truth. I mean, why? I'm very secure in my knowledge. I'm okay with that, you know. But it's always great to be open minded and learn from other people, and not be so close minded. Because I've had those people say, "Blue, how dare you talk about AAPC? You're not even a member of them. You shouldn't be saying anything." How ignorant are you? That's what I want to say. Sometimes I just delete them, block them anyway. Let's see. All right. Liz says, when I was doing HCC, where did it come? Okay. Where did it go? Okay, when I was doing HCC coding, the other coding was interesting to me. That's good. Nadia says, right. Yes, exactly. Exactly. Humble says, that's awesome, Luna. I wish you all the best. I'm taking my CCS in April. Luna says, thanks. You are not evil. JR, you're not evil. Liz says, I was just about to ask you about that. Most of the positions I saw said the CTR was required, because it's like there's like a law or something like that. I don't know if it's a law, but it's something that they have to have it. It's a requirement of a particular setting that they have to have it. So it, again, is bargaining power. That test will humble you for sure. Your jersey looks so cute, Blue. Thank you, Brittany. It says medical coder. It says 08. 08 is because I got my credential in 2008. It says my last name Garcia on the back with the 08 on it too. Let's see. Humble says, I need all the encouragement I can take. Luna says, I should have my sister make me a medical coding tumbler when I obtain my CCA. That's very cool. Distinguished Silver says, Blue is a professional review analyst related to coding auditing. That sounds like a very general job title. I would have to see what the listing says. Liz says, I'm glad homegirl's ignorance got us alive with Blue. Yeah, well, you know, what are you gonna do? And I know they're probably all watching it, because that other lady, the second lady that was talking, she said that that one of the people in the office says that they want to do a reaction video to my videos. If that happens, don't tag me. Do not tag me. I don't want to know. I don't want to see it, because I personally do not watch other creators that are coders, because I want my head to be clear. Now, I mean, it's a small world. I know some things, but I will say this, you know, my channel is my channel. My content is very much me. These are all my ideas. I'm the one who spends time coming up with the schedule and what to, you know, put out and things like that. I put it out at the last minute for a reason. But it's all me. So everything I say is all me. I'm just saying. Luna says, you can do it, Humble. Don't let the books overwhelm you. They have all the information you need. Yep. And Liz says, Humble, you will do great. Yeah. JR says, some of your contemporaries on YouTube put up with it. And you know what? It's fine for them. That's fine for them. You know, I've always been that way, though, where like if I know that person is not saying things that are really intelligent, I just kind of remove myself from the situation, and that's just how I am, you know, because to me there's just no time to waste. I don't have time for that. Now, it's one thing if you're learning and you don't know, that is something separate. I'm talking about people who are ignorant and just make assumptions. That's what I'm talking about. Not people that are learning. Please, if you have a question, obviously, I'm a tutor and I have Patreon and I do all these things. So I'm totally okay with that. And I love teaching. You know, I love an open mind. I love a curious mind. I also like when people do their research. That is the best. I'm just saying. JR says, Blue, I loved it when you told a person on the episode you are not a color. I have done that more than once. Yeah. Jennifer says, I remember that. Don't encourage him. Nicole, yes, she agrees. Yes, but it's true, because the thing is, for some, they intentionally spell my name BLUE because they think it's cute. It's not cute. My name is BLEU. Or I really hate when people spell my name BLU, because I'm not Blue Cantrell. I mean, great singer, but I'm not Blue Cantrell, and I don't like that spelling. That's just me personally. I laughed out loud for a bit for days. Oh, yeah. So that was my message for today about assumptions. Don't assume anything about me, about, coding or anything like that without asking. Do your research, okay? Because again, one person says something and then 7 people think the same thing. Like, you know me. You don't know me. You don't, okay? I will always keep the channel about medical coding, okay? On the very rare instances that I have said anything personal is because somebody had asked me and I was okay with it, A couple of years ago, I did, I was doing Vlogmas, and one of the questions that somebody had asked was about when, did I have any dating advice or something like that, or dating horror stories or something. And so I did that episode. That episode was kind of funny. That was funny. I did share about that, but again, that was my choice. And I was upfront on the channel, the show. And coincidentally, that show actually did not rate very well because it was about me. It wasn't about coding. It was just about me, And so that's, again, why it doesn't hurt my feelings that you guys don't come here for me, that you come here for the channel, you come here for medical coding. That's great, because that's the whole purpose of this channel, is to do that. I'm just saying. Humble says, if you call Blue's name a color, that really grinds her gears. I hate when they do that to Blue. Yeah, JR. JR had a field day when he found that video about when I was talking about that my name is not BLU, it's not BLUE. So he was commenting, but taking a spin at every single spelling. I said, okay, JR, oh yeah, huh? Yeah, you really hate that, huh? But yeah, so that's it. That's all I got. Don't be panicky about the fill in the blank for AAPC exam. It's just only going to be part of the test, okay? The real world is also not multiple choice, so you may as well get used to it now. Get used to looking up codes. And when you see a diagnosis, this is why, like, on Patreon, not trying to sell Patreon right now, but what I'm trying to say is this. On Patreon, I have 10 question coding quizzes. And sometimes these coding quizzes are just diagnoses to look up. And so I know some people get frustrated with that. They're like, well, no, we want scenarios. If you can't even find these, if you can't find these onesies and twosies diagnoses, and sometimes those onesies and twosies diagnoses are like 2 answers, but it's a sequencing thing as well. So there's a method to my madness. If you can't even do that, what makes you think you can look at a note and know what a diagnosis even looks like, or where to pick it up, or be able to spot it? That's why I do those, because that gives you practice. Because again, the bulk of these exams is going to be your medical coding knowledge. So when you were telling us about your mother, that was part of your coding journey. Yep. And I did that. And that episode about my mom was the most emotional episode I've ever had, where I literally cried in that episode, because it was so raw to be able to talk about her. And when I share about my mom, sometimes I talk faster because my throat starts to get knotted up, because that's just something that happens with me. I love my mother dearly, and I miss her every single day. And she is the biggest reason that I have this career that I have. She was right there with me. the whole journey. And she was there with me doing flashcards. She was there with me doing all of these things. And I wouldn't be here. I wouldn't have what I have, be on YouTube and all these things if it wasn't for her. And she saw me get into this career field before she passed. And so the fact that she could see me, that I was going to be okay and have all of this, that's what makes me proud. And she's always part of my journey because of that. And this channel is for her legacy, because if I didn't have her to be so strong with me and encourage me and tell me that yes, I can, when the times when I was really tired and working so hard, if I didn't have her telling me, you can do it, you can do it, you know. But she raised me to be tough, and here I am. And now I'm passing that on to all of you. So here we are. But I choose to share that. I choose to share that. Because that's important. You should know why I am like this. And my mom was very patient. She had the patience of an angel. Literally, she had the patience of an angel. Because I have my father's temper. You know, my father's rah, 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 you know, I have that from him. But she raised me to be tough. And it's kind of hard not to be tough with a name like Bleu. And y'all all know that my stupid aunt was the one who gave me my name, not my mom. Not my mom. That was not my mom's doing. That was my stupid aunt. That was her doing. You know? So. You're welcome. All right, guys. So with that said, your mom did a great job, Bleu. Thank you. We're thankful we have you in our corner. Good. I'm glad. I'm glad. That means I did my job. And like I said, I love all your questions about coding, and I love all your questions about the coding career field and things like that, because it's important. These are, you know, this is the big industry, you know. And like I say, keep it to coding, because that's why I'm here. Okay? Y'all don't want to know about me. That's the last one y'all want to know about. Y'all want to know about coding. That's what y'all want to know about. Anyway, guys, I am going to wrap this one up because now my voice is starting to go. Because I've been going, how long is this video? How long is this? An hour 17. It's hour 17 already. So I have some other stuff I got to do, so I will go ahead and wrap this one up. But thank you guys so much for joining me. If this video helped you, even though some of it was a rant, but what are you gonna do? If it helped you, please like, subscribe, share, and I'll see y'all next time. Bye.